There we go. Well, good afternoon, everyone, and welcome to the Franchisee Benefits Program introduction. My name is Greg Escar, and I am the CFO for Evive Brands, and we're very excited today to be rolling this out to you all and to the franchisees of our three Evive brands with assisted living locators, executive home care, and Grayson's estate sales and business liquidations, so that you can be able to offer benefits to not only to yourself as franchisees, but also to your employees that you have working within each of your systems there. So today we're going to learn more about our program. We have with us today Bernard Rubenstein, who is the founder of Franchise Benefit Solutions. And Franchise Benefit Solutions has been around quite a few years, and I'll let Bernard speak more to it. But they're also very associated with the International Franchise Association. And that is key, that he understands your world as franchisees and as franchisors like we are here at Evive. So with that, I am going to hand it over to Bernard, and we are going to go through the presentation, and then we'll open it up at the end for Q&A with it. But we're very excited to offer this for you as you guys be able to offer different benefits for your employees. Bernard.
Thank you, Greg, and good afternoon, franchisees. Like Greg said, as we go through the presentation, if you want to hold your questions to the end, there's a Q&A, there's a chat. You can add your questions, and at the end, I will try to answer as many questions as I could. Over the next 30 minutes, we're going to cover facts about Franchise Benefit Solutions, challenges facing your franchisees, why offer benefits to your employees, our program advantages, our products portfolio, looking ahead to the group special enrollment period, and solutions to help you hire and retain employees. And like I said, at the end, we'll open it up for questions or comments. With over 40 years of experience specializing in customized benefit programs, our firm provides exclusive plan designs to franchisees across the United States. Over the years, we've had the privilege of partnering with Authority Brands, Five Star Franchising, Valpak, Grocery Outlet, The Joint Chiropractic, and Jenny Craig, amongst others. In recent years, the insurance industry has witnessed many changes. Our clients are aware of the changes going on, and many have expressed an interest in offering alternative benefit plans to help recruit and retain employees. Most of my years in the insurance business has been partnering with franchisors and their franchisees. The most common challenges we find facing franchisees today are, like I've said before, hiring and retaining employees, offering affordable health plan options, new franchisees that become more apt to knowing what's available have limited benefits knowledge, ACA compliance issues for franchisees with over 50 full-time employees. Employees are the heart of any great business, and key employees and leaders are essential to long-term success. Once you have a great team in place and they're performing well, it's a huge blow to lose any of your indispensable employees. Benefits are no longer a perk in today's business world. They're an expected part of compensation. Here are a few reasons to offer benefits to your employees. First, attract and retain your best employees. By offering quality benefits, you will attract and retain qualified candidates for your business and keep your best employees happy. Second, increase your bottom line. By offering benefits instead of higher wages, you win by having lower wage base match for state and federal unemployment taxes. Third, boost morale. By offering a benefits package, you show an invested interest in your employees. In short, benefits can help promote good morale by keeping employees happier and healthier with less turnover for your business. Fourth, promote employee health and wellness. When employees have access to wellness, preventative care, doctor visits, and telemedicine programs, your overall business environment is healthier. Fewer employees are out on sick days and fewer people coming into work while ill, equals an increased productivity and profitability. Fifth, beat the competition in the race for talent. By offering an ACA compliant health plan and voluntary benefits, you can beat out half of your competitors that do not offer benefits. And finally, the sixth, create loyalty. Health insurance is an emotional offering. It says to your employees, you're a valued asset to this company, and we care about your health and well-being. You're probably thinking, why should we go with Franchise Benefit Solutions? What's the advantage of your program over other programs? Or what if I looked at a similar plan on my own? First, we offer exclusive plan rates with a guaranteed acceptance and no waiting periods. Our plans and rates are the same no matter where your franchise is located. If you have a franchise in Florida, Michigan, Washington, or California, the plans and rates are the same. We don't require employer participation or contribution. Plans can be employer paid, standalone, voluntary, or packaged together through payroll deduction. You choose the benefits you want to offer your employees, and then the employees enroll online through our online portal. Like I said, plans can be employer paid, standalone, voluntary, or packaged together. Our products portfolio includes medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, and short-term disability. Our products portfolio includes 3 health plan options: individual and family, comprehensive group health, and voluntary group health. For those franchisees that don't want to offer a group plan for their employees but are looking for an individual health plan for themselves or their family, we offer an online quoting portal you can view at your own convenience. We understand that most employers would rather not speak to one of our agents. They want to be able to look at a individual plan on their own. Our individual and family quoting portal will allow you to do that. Once you input your personal information, you can compare affordable health plans from different carriers, find out if you qualify for financial help through the marketplace, view benefits at a glance, view local providers, and even apply online or download an enrollment form. If you're considering group medical options, we can help you make the right decision that best meets the healthcare needs of your business and your employees. Group plans are based on the demographics of your company, along with your employee and dependents' ages. We would need census information in order to provide you with a group benefits proposal. We also offer an ACA, non-ACA compliant plans. ACA compliant plans are community rated, while the non-ACA plans are based on the demographics and medical history of your employees. Non-ACA plans can be much lower in cost than the ACA plans. ACA plans require a minimum of 2 enrolled employees and will accept eligible waivers such as Medicare, Medicaid, Marketplace, spousal coverage, or other group plans. Non-ACA plans may require a minimum of 5 enrolled employees and will not accept any waivers. For example, if you have 15 employees, a minimum of 7 employees are required. The ACA plans are plans that have been offered since Obamacare or the ACA began in 2010. The non-ACA were plans that were available prior to the ACA inception. Our most popular option is our low-cost voluntary group health plan, similar to an association health plan. Our voluntary MEC plans are all about easy access to the healthcare system, otherwise unattainable for many employees. The basic MEC plan covers preventative services only, while the MEC Plus and Advantage plans covers preventative services, primary care, and specialist visits, along with urgent care, lab and x-ray services, and generic prescription drugs. The Advantage plan includes value-added benefits through MetLife, which is a benefit payout to the employee to help avoid a financial crisis. Members pay co-pays only, and there is no balance bill for those covered services. Members must utilize a PHCS network provider and excludes all out-of-network services. As you can see on the screen, there's 3 plans that are offered. The basic MEC covers physicals only, any type of service that has to do with a physical, such as the exam, any type of testing, including colonoscopy, mammograms, any type of blood or urine testing is all covered 100%. The MEC Plus plan covers routine physicals, primary care specialists are 15 copay, urgent care, lab, and x-rays, $50 copay, and generic prescription drugs is $15 copay. The Advantage plan, similar to the MEC Plus, however, it also includes the value-added benefits through MetLife that's paid to the employee. It is a minimal hospital indemnity coverage for hospital admission, intensive care admission, hospital confinement, hospital ICU, and newborn nursery confinement. As I mentioned before, there's no employer participation required or contribution required. Same plan, same rates in all 50 states. We also offer a minimum value plan. The plan provides more comprehensive coverage, such as in and out patient, in and out hospitalization. Also includes diagnostic testing, inpatient, outpatient surgery, anesthesia, emergency room care, ambulance, maternity, home health care, and rehab services. And finally, it also includes prescription drugs. The advantage of this plan is that it is more of a comprehensive plan, similar to, let's say, United Healthcare or a Blue Cross plan. As you can see at the bottom, there's asterisks after the inpatient benefits. What that means is the benefits are subject to reference-based pricing, which is the same as Medicare. So the plan will pay up to 200% of what Medicare will pay. And in order to find a hospital that may be covered under the plan, as long as the hospital accepts Medicare, then the plan will be available for that hospital. So again, all we need on this program is 2 employees. On the MEC plan that I showed prior to the screen, we require 1 employee. And again, this plan here, which is becoming more popular, we require 2 employees. A husband and wife or a husband and spouse can be considered as 2 employees. Our dental plan option, we have 3 plans through MetLife, which are PPO plans. And we also offer a HMO plan through Delta Dental, and this is a California-based plan only. So the 3 plans that we offer through MetLife, deductible are $50 and $100, $150 for the family. Benefit options, 2 of the plans is $1,000, while the 3rd plan is $2,000. Plan 3 covers preventative, basic, major, and does not cover orthodontia, but covers up to $1,000. Plan 4, same as Plan 3, except it also includes orthodontia up to $1,000. And then Plan 5 is the same as Plan 4, but its benefit is up to $2,000. The difference in cost on a single individuals, about $10 difference between Plan 4 and Plan 5, whereas the benefits are doubled. Vision coverage is administered through MetLife, but the network is through VSP. We offer two plans. The 1224 is a $10 copay for the exam every 12 months, lens frames every 24 months. The 1212 also has a $10 eye exam every once a year, 12 months, and the glasses, lens frames once a year. So the difference between the two is 1224 glasses every 2 years, 1212 once a year. We've also included Sam's Club now for the retail chain providers, along with Costco and VisionWorks. Life insurance, we offer two plans. Group life, employer pay, $10,000 for each employee. Voluntary life, this is employee pay. Employee can purchase up to $150,000 on themselves, spouse $50,000, dependent children up to $10,000. Evidence of insurability will not be required when they are first eligible. And again, this plan is also through MetLife. Our telemedicine program is through Teladoc. So let's say you're at work and you're not able to visit your primary care. You can call in to the doctor, Teladoc, and you'll speak to a doctor within 14 minutes. No copays or deductibles. You will be speaking to a US-based trained and board certified doctor. You can provide them with your symptoms. They'll give you a diagnosis and they'll even call in a prescription for you. Unlimited use for all family members, up to 5 per family. I know it works well. I used it about 3 months ago. Rather than visit an urgent care, my wife had me call into the Teladoc, and it was actually the first time I've used it, and it worked well. They called in a prescription for me too. Hospital confinement plan. This is a good program that you can include with your Met plan. We find that franchisees will offer the Met Plus plan. They may contribute, and then they'll offer the hospital confinement high or the highest plan. So we have two benefit options. The Met plan pretty much cover the doctor visits, lab, and urgent care, whereas the hospital confinement will also add additional hospital benefits, such as hospital admission, outpatient treatment received in the hospital, emergency room, and also the physician's office. Additional benefits include the surgery, anesthesia, diagnostic exams, pregnancy, and lodging. We also have a 5-year rate guarantee. We also offer an accident plan. And as you can see, most of these plans, other than the medical, is offered through MetLife. The accident plan covers accidental injuries regardless of any other plan you select. Benefits cover both inpatient and outpatient treatment, covers more than 50 benefits, including hospital admission, hospital confinement, ambulance, emergency room treatment. In addition to those services, the plan will pay a lump sum payment for fractures and dislocations. And this plan also is a 5-year rate guarantee. Our benefits enrollment platform includes 4 steps from the initial contact. So from the time we begin our conversation with you onto the enrollment process. Step 1 is a discovery. The first step is to identify your objectives of offering benefits that reflect both you and your employee needs, your budget. And then we will gather the group information, discuss your goals, benefit options, and what your budget is. Once we receive that information, we move into step 2, which is the analysis. It's important for employers to be strategic when deciding what to offer. We will review benefit options, costs, and help set up benefits program that will help you attract and retain employees. So from step one, once we gather the information, to step two is where we provide you with the quotes and review all your options. Once you decide you're going to offer a program, we move into step three, which is the communication. The communication strategy is a critical component to the benefits planning and management. We will develop easy to understand benefits communication for you to share with your employees. And then once we share that with you, we'll set up a enrollment portal, which is step four. Our online enrollment portal helps employers spend less time collecting and reviewing forms, communicating benefit details. For the employee, they can select a benefit option best suited to their specific needs. So basically, we'll once we received information on your employees, we'll upload it to our portal, send them login information. Employees will register, complete their profile, dependent information, and then go through the enrollment process. Once the enrollment process is completed and they receive a email or they receive a finish button, then you have you'll be able to go into the system, view all your employee enrollments, download payroll deduction report, and you'll also be able to, depending on your payroll vendor, integrate with our portal with your vendor service. We recently found out that I'm sure a lot of you use ADP, that once you add a employee to your ADP payroll, that automatically they'll be able to be set up in our enrollment platform. So we are, I know for sure ADP is one of the vendors that our software is utilizing. So we do have other vendors, but once you decide if you're going to move ahead with the program, then we can discuss on the integration. Key provisions of the Affordable Care Act. Most of you know that the individual mandate no longer exists in most states. Individuals will not be penalized for not having health insurance. The employer mandate, however, remains in place, at least for now. Here are a few provisions of the ACA and how it will affect you. A full-time employee is an employee that works at least 30 hours. Benefit waiting periods must be 90 days or less. I know a lot of employers, we get this call every day, they have a 6-month waiting period. Under the Affordable Care Act, the maximum waiting period is 90 days. Basically, it's a 60-day waiting period, or first of the month following 60 days, which could be 90 days. Employers with less than 50 full-time equivalent employees are not penalized for not providing health insurance. So if you have less than 50 full-time equivalent, you are not penalized. You do not have to offer health insurance. Employers with 50 or more full-time equivalent employees must provide health insurance or pay a penalty. So if you have, let's say, I know some of your franchisees have maybe 100, 125 employees, of which most of them work variable hours. Again, it's all going to depend on how many full-time equivalents that you have out of those 100, 125 employees, or even less than 100. So if you have questions on it, don't understand how the ACA works, give us a call. We have a ACA expert on staff that will work with you, and they'll even provide you with an analysis without cost. Looking ahead to 2024, I know we're only in mid-year, but I'm bringing this up to probably lay the groundwork for the special enrollment period. I'm sure you've heard of the annual individual open enrollment, what we're looking at here is a group special enrollment period. This is a little known requirement under the ACA, which requires health insurers to offer an annual 1-month special enrollment period from November 15th through December 15th to employers in the small group market who do not meet the employee minimum participation or employer minimum contribution requirement. Many insurance brokers do not know about this requirement. Insurance carriers do not want you to know about this. Under normal underwriting, insurance carriers require at least 50% of eligible employees to enroll. Under the special enrollment period, 2 full-time employees must enroll. Just to let you know, under the ACA, a husband and wife are considered as one employee. So if you're looking for a comprehensive medical plan, and this is where we probably enroll 80 to 90% of our business is through this 30-day window. So if you're looking to put in a group medical program, this is the time to do it. If you have employees and you're not able to or do not want to offer benefits to your most of your employees, and you're looking for, let's say, a management only plan, this is the time to enroll. So again, 30-day window, all we need is 2 full-time employees, 2 W-2 active full-time employees. So what are our most popular solutions to help you hire and retain employees? So our top 4 packages include package 1. Employer offers a dual medical plan and contributes towards the employee-only costs. Employee contributes to the balance of the employee cost plus dependent cost and a buyout. So the employer only contributes to the MEC plan. And again, you don't have to contribute, but we find employers have better participation by offering a minimal participation contribution. Then the employee would contribute the balance plus any dependent costs, and if they want to buy a better plan. And then you offer voluntary benefits at 100% employee pay. So I would probably say that 90, if not higher, 95% of our employer groups do not contribute towards the voluntary benefits. Package 2, employer enrolls in a management-only group health plan through the special enrollment period, whereas the employer contributes, obviously for themselves, they'll contribute 100%. For management, if they set up a management other than themselves, they'll contribute 50%. And then the employer will offer the voluntary benefits to non-management, which will include the MEC plans, plus the any of the voluntary benefits. Package 3, employer enrolls in a comprehensive health plan. Employer offers dual medical option, and I'll bring up, let's say, United Healthcare. You select 2 or 3 medical plans, you contribute 50% of the employee's single rate of the lowest plan, and then you allow the employee to upgrade. And then you offer the voluntary benefits 100% employee pay. And then package 4, which actually is becoming more prevalent, it probably should be either number 1 or 2. The employer offers the voluntary benefits to all employees, 100% employee pay. Again, healthcare cost is increasing on an annual basis. A lot of employers cannot afford to offer benefits. This is why they'll offer our program on a voluntary basis without any employer contribution. To give you a cost breakdown, I've kind of set up a plan that may apply to you and may not, but I thought I'd throw in just to give you an idea of what some of the cost may be. So in setting up a plan, step 1, you set up a class based on the employee's job title. Class 1 could be ownership, class 2 management, and class 3 non-management. Just remember though, whatever you're offering in that class, the contribution has to be the same for all employees in that class. For instance, if you have 3 management employees, you have to offer the same plans and the same contribution. If you have a management employee that you don't want to offer, then you would probably have to set up a separate class for that employee. Step 2, employer sets up a comprehensive group health plan for ownership and management level employees. And you set up you contribute 100% for ownership and 50% for management employee. Step 3, you set up a voluntary medical plan for non-management employees at 100% employee pay. And then step 4, you offer voluntary benefits at 100% employee pay, for which includes all the voluntary of hospital confinement, dental, vision, life, telemedicine, and accident plans. Give you an idea on monthly costs, and again, don't hold me to any of the cost here. This is just a rough idea. Owner, let's say, is age 55. Through United Healthcare, he offers a PPO plan, $2,000 deductible, 80/20 coinsurance, $40 primary care copay, $50 urgent care copay with a $15 prescription drug card. Monthly cost for himself is about $885. Obviously, he's going to pay 100% of that cost. Let's say he's got a management employee, age 47, again through United Healthcare, but he offers a higher deductible plan through the management employees. Same coinsurance, same office copay, urgent care, and prescription drug card, but the cost on this is $667 for the one employee. Employer contributes 50% or $328, as well as the employee contribution. Then he offers a non-management employee, again, age 35, the MEC plan, MEC Plus plan, office visit, urgent care, and prescription drug card. Monthly cost around $118, whereas the employer does not contribute, and the employee would contribute 100% of that cost. And again, this is just a cost breakdown, an example of what we can help you set up. I know it's over 30 minutes for the presentation, but I'll open up now for any questions. Greg, I see you're back on here. If you want to read some of the questions.
If you have any questions, why don't you send them to the Q&A? I'll be glad to read them out loud to Bernard or through the chat. And we go from there, because since everybody is muted at this time. So the first question that I see is any of these types of plans that you were presenting today, Bernard, are they appropriate for a single person business? A lot of, especially like Grayson's, or I would say assisted living locators, it just might be the franchisee themselves. Can they put a plan together just for them?
Yes, and really they can do two things. One, they can go on our online quoting portal and to see what individual plan would cost in their area. Second would be is they can enroll in one of our voluntary MEC plans, because we go down to one. They can also enroll in one of our MV plans. We do need two to enroll, so a husband and wife can constitute a 2-member enrollment, so we can go ahead and do that. So there are different options for that individual franchisee.
Right. Received a couple questions with regards to, can they see a list of providers in their area, depending on what plan they choose and the networks and all. So I've had a couple questions that came through with regards to that. So what's our answer to that, Bernard?
Yes. So when we discuss our program with you, we'll provide you with the provider network. But I will strongly suggest that if you see your provider in the network, the online network, that you call your provider, your primary care, because there are many times that we find out that they're listed in the network, but when they call their provider, they no longer accept the insurance. So it's something that I would definitely advise you to call your provider. One thing I do want to bring up, Greg, that our program is really set up where the employer can decide what they want to offer, what they want to contribute. Let's say you have 5 employees or 4 employees or whatever, and only one employee wants to enroll, but they only want to enroll in dental. We'll take that one employee. Again, that's our advantage, because if you looked at a program individually on your own, most carriers are going to want a participation of at least 5 or 10 employees. Our program, we go down to one, and we don't care what plan that your employee enrolls in or yourself that you enroll in. So you have total control how you want to set up the program.
That's what was very exciting when we were learning about the programs, just the flexibility that you have as the business owner to set up these plans, and that there not any rules with regards to what you have to contribute to and to whom. Another question has come in. It says, and I think we've answered it, but we just want to make sure we're addressing all of this. If you are an employer and only one employee, can the employer pay 100% of the voluntary benefits? And also, did you show anything with regards to short-term disability? And do you offer that?
We do offer short-term disability. Now, most of our voluntary products is through MetLife. And, obviously, I would hope that most of you have heard of MetLife. So we do have a plus carrier that's part of our program. You can pay for 100% of your voluntary benefits. Totally up to you how you want to set up the program. You have full flexibility.
Yeah, and I would also comment, as Bernard stated, that just to confirm your doctor, I would do it the other way too. If you did not see your doctor on the list, to confirm that maybe it's just a timing issue, and that they are part of that program. So I would look at it on that way too. Bernard, again, a couple questions is, can you send the location for the insurance portal that you will use on this, or kind of like what those next steps look like?
So I think what our plan is, we are recording this webinar. We will be sending out the webinar most likely next week. And along with the webinar, we'll be sending you the employer guide that will include all the plans we offer and the rates. And then we'll also include the insurance portal and the provider network. Now, the provider network is only going to be for the voluntary plans. When it comes for the comprehensive program, again, that's going to be a one-on-one conversation with you. And it'll depend on what state you're in on, when it comes to the provider network.
Any other questions? Hold on, another one just came in. Sorry. Feel like I'm a DJ here. Hold on one second. If we are already doing some voluntary benefits through a company like Aflac, is it okay just to cherry pick things that you offer that they don't, like dental, vision, medical, those type of things?
Again, flexibility. You decide how you want to set up the program, what you want to offer. I will tell you that you may want to look at our program versus your Aflac. We were with that Aflac before we moved over to MetLife. Our plans, we've compared to many Aflac plans. I would most likely your Aflac plan is based on your location only, whereas our MetLife program is based on all of our franchisees that we work with on a national basis. So we, when we searched the market, we used a census of several thousand employees, whereas probably the program you offer through Aflac is probably on your own location. So again, you can keep Aflac. You can, like you said, cherry pick the plans you want to offer, but totally up to you.
Right. Another question came in and it says, hey, my husband lives in another state. Can he be covered as well?
Yes. Our program is a national program. So you decide how you want to set it up. So if you just say, this is the one plan I'm going to have, doesn't matter if you're in California, Michigan, or Florida, or Arizona.
Thank you. Any other questions? I didn't hear or know of any of these things that you guys have been asking. That shows to the flexibility of this plan. We do think it's exciting that you're able to offer this to your employees and to yourselves also, and that this will set us apart as brands compared to some of your competition with regards to this, having this capability. Any other questions? Please type them in. We'll give it another minute and see if any more come in. And if not, we will, I'll just turn it back to you for any final words, Bernard. So give me just one more minute. And we'll go from there. Well, doesn't look like, I know it wasn't a minute, but doesn't look like anything else is coming in. I do want to say thank you all for being on this call. I hope that you will take advantage of thinking through if this is a great opportunity for you. If you have more questions, please reach out to Bernard and the team there at Franchise Benefit Solutions and all. So Bernard, any final words for our franchisees?
I do. I forgot to go one more slide here,
That's a
Greg.
key. That's a kind of a key slide for everybody right here.
This is the key slide. I'm sorry. My son's actually going to be or is your contact. Here's his contact information. I think one of the brands, Lisa Smith, asked about contact information.
Mhm.
We will be sending out a contact page also that you can complete and send back, submit it. But Michael is the contact for Evive brands. Here's his contact information. Again,
keep in mind, this will just be part of what we send out too, so you'll have it.
definitely. Correct. And I think some of the brands themselves have our contact information too.
No doubt. Look, if you need it, if you forget it and want it right away, let us know. Write it down now or reach out to any of us here on the call. So thank you. Well, I don't think I see anything else. I gave some people some more time. So Bernard, anything else? We're just excited for this partnership that we have with Franchise Benefit Solutions and Evive Brands. And we do thank you. Bernard, I'll give you the final words. So thank you.
Well, again, thank you, Greg. Thank Evive Brands for allowing us to partner with you. I hope our benefit programs will help you with your hiring and retaining. Again, we find that as the number one challenge for most franchisees, for most businesses these days. And I'm hoping that our program will benefit you and your employees. Thanks again. And we'll get out our information, like I said, within the next week.
Great. Thank you all. Appreciate your time. I hope you and you all have a wonderful evening, and I'm looking forward to seeing your participation in the plan. So thank you all. Take care.
Bye-bye.
Thanks, Bernard.
Take care. See you, Greg.
See you next week. Bye now.